Hi everyone, this is Jenny, and I did my fieldwork at Stellar Farmers Market through the New York City Department of Health from July to November 2018. And my research focuses on the impact of health bugs. Stellar Farmers Market is a program of the Department of Health and Mental Hygiene, which provides free bilingual nutrition education and cooking demonstrations at farmers markets in underserved communities. All workshops are translated into Spanish and an additional language such as Mandarin, Cantonese, or Bengali as needed. Each week features a new recipe and a new nutrition lesson. Here's an example of one of the recipes featuring apples. This is what participants take home with them after each workshop. And here's an example of one of the nutrition lessons that are given to all the educators. This particular lesson is used to encourage participants to eat a variety of fruits and vegetables in different colors. My task as a nutrition educator includes preparing for lessons following the Just Say Yes to Fruits and Vegetables curriculum, using flip charts as a visual aid with open-ended questions to facilitate discussion. I also use teaching aids such as handouts, food models, and even real ingredients from the farmers market in the lessons itself. As the nutrition educator, I also serve as the team leader of 3 to 4 people, including myself, which usually consists of 1 culinary educator and 1 to 2 bilingual educators. I attended weekly nutrition educator meetings held by head nutritionist Angela DiMaggio to go over the lesson of the week as well as receive updates on changes such as coverage for the week as well as submit paperwork. I also communicate with program coordinator Margaret Duncover with any issues or requests. I was assigned to 2 markets, Grassroot Farmers Market and 97th Street Green Market. At the farmers market, I assist in proper setup of the workshop area, which includes a tent, cooking equipment, and educational materials. After setup, I shop for ingredients that will be used in the recipe of the week right at the market. Sometimes there are really cool fruits and vegetables such as yellow watermelon and purple radishes. Anyone is welcome to join the workshops. We often have participants who love the workshops and come back every week, especially seniors, and it's really nice to build their knowledge week after week. After the workshop, they have a chance to taste a sample of the recipe made by the culinary educator and take home the recipe of the week and or any resources we provide, such as SNAP brochures and farmers market maps. After tasting the samples, they fill out a short survey and receive a health buck as an incentive for participating in the workshop. Health bucks are $2 coupons eligible for purchases of fresh fruits and vegetables at participating farmers markets in New York City and are distributed by the Department of Health. Health bucks were originally introduced in 2005 to increase purchasing power to make fresh produce more affordable and accessible. In addition to distribution at workshops, those who use EPT can get an additional $2 coupon for every $5 they swipe at the farmers market. Community organizations may also apply and request for health bucks to distribute for nutrition or health-related programming. Specific objectives for health bucks are to increase the consumption of fresh fruits and vegetables to promote healthful diets and increase access to locally grown produce. So what exactly happens after the participants have left the workshop? What happens to the coupons? Are they being used effectively? And how effective is the health bucks program? The goal of my research paper is to assess the effectiveness of the health bucks program at farmers markets. This study done by Olsho et al. Evaluates the impact of a farmers market incentive program on fruit and vegetable access, purchase, and consumption. This study used surveys and phone calls to collect data at farmers markets and district public health offices, or DPHO, communities in addition to using community health survey data. This table illustrates the frequency of shopping at farmers markets by participants' level of experience with health bucks. Those who have never heard of health bucks are represented by the black bars, whereas the lightest gray bars represent those who have used health bucks in the 2010 season. Those who have the most experience tend to shop at the farmers markets more often. The top graph is data collected from the farmers market, and the bottom graph is data collected from DPHO neighborhoods. This study found that greater health bucks exposure was associated with greater awareness of farmers markets, increased frequency and amount of purchases at farmers markets, and were more likely to self-report year-over-year increase in fruit and vegetable consumption. This next study was done by Payne et al. And was titled Implementing a Farmers Market Incentive Program Perspectives on the New York City Health Books Program. Payne et al. Aimed to gather both qualitative and quantitative data by analyzing data given and interviewing and/or surveying farmers/vendors, market managers, and program administrators. Payne et al. Found that the distribution of health bucks increased 46-fold from 3,000 coupons in 2005 when it had first started to over 130,000 coupons in 2010. At first, only community-based programs were distributing health bucks, but after 2007, the EBT incentive component kicked in and made up 71% of health buck distributions in 2010. When farmers were surveyed on how health bucks impacted them, they reported they made more money, new customers shopped more often at their stand, they sold more fresh fruits and vegetables, had more repeat customers, and more people bought new or unfamiliar foods. Payne et al. Concluded that incentive programs such as health bucks may be one way to increase access and affordability of fresh fruits and vegetables among low income persons. The next study by Berenberg et al. Evaluated the impact of New York City's Health Bucks program on EBT spending at farmers markets from 2006 through 2009. They analyzed 4 years of EBT data to see the impact of the EBT incentive program, providing an extra $2 spending power for every $5 used. The data used was provided by Green Market, which is the largest farmers market network in the United States. This graph was used to compare EBT sales at markets that had the EBT incentive versus those that did not. In the years 2008 and 2009 was when health bucks were distributed to EBT versus 2006 and 2007 when it was primarily distributed through community-based organizations. There was a statistically significant increase in EBT sales, almost doubled in 2009 when compared to markets that did not accept health bucks. They also looked at the average EBT sales at 4 select farmers markets before and after the EBT incentives. Markets A and D had statistically significant increases in EBT sales from 2006 through 2009. Berenberg et al. Concluded that when EBT incentive programs such as health bucks were implemented, the use of SNAP benefits increased, which means more low-income shoppers were able to purchase fresh produce, increasing healthful food access. In a similar program called Philly Food Bucks in Philadelphia, there were similar results. Food buck users were more likely to report increased fruit and vegetable consumption than those who were not. EBT sales had also more than doubled at farmers markets in low-income areas. In conclusion, incentive programs such as health bucks and Philly Food Bucks were effective in increasing affordability and accessibility of high-quality fruits and vegetables. EBT sales at markets increased dramatically with the program, and users were more likely to report consuming more produce. Additionally, farmers and vendors found it to be beneficial to their business. I've also experienced the positive impact of health bucks at the farmers market myself. Oftentimes, participants will go directly to the vendors after leaving the workshop to buy produce, and sometimes will even come back to our tent to show us what they bought. Health bucks were proven to be effective with high redemption rates and should serve as a program model for other cities who may want to implement it. Thank you for listening. There will be more details in the paper to follow. References are included at the end of this video. Thank you again.